Our kids need help. The U.S. Surgeon General put out that emergency alert about the youth mental health crisis. A Des Moines pediatrician told us that she's seen this crisis worsen over the past 2 years.
Over the past 20 months, we have seen a dramatic increase in pediatric visits for depression, anxiety, grief, loneliness, eating disorders, any number of mental health issues. And we've also seen an increase in emergency room visits for suicidal thoughts and suicide attempts. So this is a very serious issue that's going on in our state as well as across the country. And yes, of course, we're very concerned and we're doing all we can to see how we can support Iowa's children.
And she feels there are several major causes for what's happening here.
Kids would come into my clinic and they've been out of school and they were at home and they were spending more time on social media and less time in person with other people that they care about. And so lack of one-on-one attention from teachers, lack of interaction with their peers really affected them. We know that the social development of teenagers means that they have to be hanging out with their peer group, interacting with their peer group, and also engaging in things like sports and other clubs and groups, things that give their life meaning, give them goals and accomplishments. And we really weren't seeing any of that during COVID. So the teens that I was seeing in my clinic were really lost. They didn't have any direction. They didn't have anybody around to kind of support their social and emotional growth. So we've seen a lot of effects: the lack of activities, the lack of sports, the social isolation, and then also a lot of loss and grief. Over 140,000 children across the country have lost a loved one during this COVID epidemic. And so there's so many factors contributing to this.
So this got worse during the pandemic, but now what?
There are calls to action for us as parents and us as the pediatric providers. And then also in terms of our policymakers, there's a call to action. So we all need to be doing our part to support children's health, because really our children are everything. They're our future. So as a parent, I have a teenager at home. And so things that we can do to support our teenagers is, number one, make sure that we're helping them have a safe, secure, and nurturing environment at home. That doesn't mean being permissive about everything. It means setting firm boundaries that keep them feeling safe and help them learn, but also really making sure that we're paying attention to their needs, we're understanding their developmental stage, and we're just really providing that nurturing, responsive, positive caregiving that we can do. Second thing we can do is really encourage teens to have good relationships with their peers, like understand who their friends are, help them find different connections, whether it's through activities or just one-on-one, but really connecting with peers in a positive way. And then just being attuned to some red flags that might come up, or notice some warning signs. If they come home and don't report anything at all good about school, what's going on there? I know I have just seen 2 kids yesterday who are experiencing some bullying at school. So it's really important to be attuned to what's happening at school. A lot of kids had a lot of problems adjusting to getting back into school after being gone for a while. And so it's important to just know what's going on. It's also important for parents to be aware of how much time kids are spending on social media, what types of social media they're using, and what kind of influences social media can have. We know, for example, that image-based social media like Instagram can have negative effects on our kids. So it's important for parents to have that discussion with kids. Hey, do you think you're being influenced? Do you feel bad about yourself when you look at Instagram? And are you maybe someone who's at risk? So encourage kids to take breaks, to maybe follow like things that aren't as image based, and to have more one-on-one interactions with friends through other social media that allows kind of some face-to-face interactions, or actually just go see their friends safely.
A lot for parents to think about. Now, another call to action next in the Insider's Quick Six.